Hi, my name is Gail Clayton. I'm a registered pharmacist and a certified nutrition specialist. I want to share with you today an extraordinary case that I had worked on, and hopefully it will give you some other ideas on how to approach autism and sensory processing disorder. So I took a biomedical approach in treating sensory processing disorder using high-dose biotin in an autistic child. And so what we're going to do is we're going to explore the underlying biochemistry using the NutrEval intermediate markers by genetic diagnostics. Now, in this child, his current treatment was neurofeedback therapy, occupational therapy. He was seeing a neurologist, a naturopathic physician, an integrative physician, and he was also doing Taekwondo a couple of times a week. So let's start with his timeline. 2010, he was born with a Chiari malformation of the skull. It wasn't really thought to be causing any issues at this time. In 2012, at age 2, he was hospitalized for fever, and he was given IV antibiotics. And by age 4, in 2014, he was diagnosed with pyrrole disorder, and they subsequently went gluten-free at that time. And in 2015, in April, he was diagnosed with sensory processing disorder, and at that time, the parents had chosen to stop vaccinating. And then in 2015, in September, they had moved to a rental house, and he started regressing. And they found out that the house was contaminated with diesel fuel. And it took them quite a bit of time to find a suitable house and move. But they did move again in the summer of 2016. Now, in February 2016, there was some stool testing done, and he was shown to have really high streptococcus levels in his stool. And they put him on pulse dosing of erythromycin and high-dose probiotics, digestive enzymes, and oxbile. And the mom had reported that she noticed huge improvements in his bowel movements at that time. Now, a few months later, in June, it was confirmed that he had Dientamoeba fragilis, and the doctor had thought that was what was causing high eosinophils on some of his tests. And they started him on a treatment of antifungals, but within 5 days, they had to stop it because it was making him so sick. And then that's when the mom contacted me in July, and I had recommended to do the NutrEval by genetic diagnostics. So in interviewing the mom, her chief concerns of her child was this hyperactivity and spinning behavior. He would stand in the middle of the room and just spin and spin and spin and spin around in circles. He had migraines with an aura. He had a severe addiction to carbohydrates and sugar and milk. And she said that he would just whine and whine and whine until he got his junk food fixed. And then he would have these energy crashes in the afternoon. And he also had histamine intolerance and seemed to have real sensitivity to foods high in histamine, and just about anything would trigger a histamine response. And she wanted me to see if there was anything that I could do from the NutrEval test that would improve his brain health, improve his sensory issues, improve his gut health, and help decrease his headaches. So in reviewing everything that had been recommended by his doctors, his naturopath, and integrative physicians, I made a list of everything that he was on, and I was really impressed because I felt like they were really addressing the major issues that come along with sensory processing disorder and autism by supporting methylation and zinc and vitamin E and melatonin and acetylcarnitine, helping support the acetylcarnitine, helping support the Krebs cycle and ATP production, and then of course supplements that help support the detox pathways that are commonly a problem in these children, and also supporting the gut with prebiotics, probiotics, and enzymes. Now, when I got the results back from her NutriVal, this is the very first page, and it looked like he, despite all of the supplementation he was on, it looked like he had quite a few high-need deficiencies and quite a few borderline. Now, with autism, we have to be really careful at which nutrients we select and what order they're given, because if we speed up methylation and there's a block in the and another further downstream pathway, we can actually create more toxic intermediates and cause the child to digress further. So instead of just giving him a whole bunch of supplements, I really wanted to focus in on and minimize the ones that were the highest need. So in order to do that, I looked at the intermediate markers. So this is the page that I really focused on, and you can see that I've circled the markers that are the most important on this page. So this first marker under cellular energy and mitochondrial metabolites on the left that's elevated is called 2-hydroxybutyric acid, which I call BHBA, and that's a marker for ketosis. Now, he wasn't following a ketogenic diet, and so there was some reason why his body was making ketones for energy instead of using glucose. And so when I looked at the Krebs cycle under the energy metabolism, there was two markers there that were elevated that was consistent with an upregulation in the glucose pathway. This alpha-ketoglutarate was 4 times higher than the 95% reference interval, and that's significant. So with alpha-ketoglutarate, there could be 2 reasons why it's, that high. If we had a deficiency in the enzyme and the alpha-ketoglutarate dehydrogenase and unable to process alpha-ketoglutarate, that marker could go high. But alpha-ketoglutarate also serves as a flux between the Krebs cycle and the gluconeogenic pathway. And so the malate was also elevated too. And so I felt like what was going on here is that his little body was trying really hard to make glucose to help regulate the gluconeogenic pathway, and that's why this was elevated. And so to take a look at what else was supporting that pattern is the isovalerioglycine. It was a little on the upper normal range. The 3-hydroxyisopropionic acid was kind of borderline high. And then this last one here under the vitamin markers is this 3-hydroxy isovaleric acid. That marker is very specific for biotin. And even though, it's not way in the red, I find it very significant because when you put all of these markers together, it tells a story. And his story was that because of a biotin deficiency, he was unable to regulate glucose properly in the liver. So because biotin is required in the as a cofactor in 4 different carboxylation reactions, and one of them is in the liver that kickstarts that very first step in the gluconeogenic pathway. So with all of these markers elevated, I felt like biotin was the issue. So biotin is made in the gut by a bifidobacteria. And the bifidobacteria on his stool test was low, with a corresponding overgrowth of some pathogenic strains, and also biotin. We get biotin from our food. So with the combination of that, the fact that his bifido was low, and these markers, I felt like biotin, he wasn't getting enough biotin in his little body. So another thing that when I look at biotin deficiency and I see this pattern, there's several enzymes that I am very suspicious of, and one of them is the holocarboxylase enzyme. So the holocarboxylase enzyme will pull biotin in from the small bowel and bring it into the and attach it to the other four enzymes of the carboxylases. And when I looked at his 23andMe data, I made a screenshot here, and there's you can see that there's quite a few genes associated with this enzyme. But, we are so new in this whole epigenetics, and there's not a whole lot of information about which one of these genes are actually responsible for lowered enzyme activity. But I did find some information that many of the genes have been correlated with the lower enzyme activity. And so, as you can see here, almost every single one of them that was reported from 23andMe had at least a heteromutation. Now, another contributing factor on him was that he had some FUT2 SNPs, and FUT2 is a enzyme in that the bifidobacteria uses to grow and proliferate in the small intestine. So this could, result in lower bifido growth. So a combination of lower bifido growth and overgrowth of other bacteria, and the fact that he had multiple genetic polymorphisms in these genes of the holocarboxylase enzyme, what I felt that the focal point is that because biotin is so central in making energy, and it's central in fatty acid synthesis because it's used as first step in fatty acid synthesis in a carboxylation reaction, and it's used as in the first step in gluconeogenesis in the liver. And our brain is all like 75% fat. So if you can't synthesize these long chain fats for the brain, it typically shows up in the skin and the brain, cognitive problems, and and what I see is it come out as sensory issues and sensitive skin, and so I felt like the focal point was his problems with glucose control and ATP energy production. I thought maybe he had a holocarboxylase enzyme problem and maybe alpha-ketoglutarate dehydrogenase enzyme deficiency. I felt like he was experiencing episodes of hypoglycemia that was a contributing factor in some of his sensory issues. And then there was a block in the fatty acid synthesis that was affecting brain health. And my goal was to optimize the biotin carboxylation pathways to restore gluconeogenesis and fatty acid synthesis in the brain, and also to help bolster ATP production in the Krebs cycle by using high-dose biotin. Now, my recommendations was for him to just continue his current mineral and vitamin supplementation, but I wanted to increase the biotin that he was on from 300 micrograms daily to 4,000 micrograms daily. And since biotin and vitamin B5 share the same receptors for absorption from the gut, giving a high dose of biotin could essentially cause a B5 deficiency. So I went ahead and put him on B5, but separated them a couple of hours apart so that we wouldn't cause problems. And also B5 is so central in the liver for providing energy for many of these reactions to happen. Now, then the next thing I added was lysine. I wanted to give him lysine because on his NutriVal, which I didn't show on the previous slide, his lysine was very, very low. And the reason why lysine was so important is because on these 4 carboxylation reactions, these carboxylase enzymes, the terminal amino acid where biotin binds to is lysine. And I wanted to make sure that there were plenty of binding spots for biotin on those enzymes to really make a difference and make sure it was working efficiently. And then, of course, I added some lipoic acid in divided doses. And lipoic acid is so central in helping regulate glucose control. And also lipoic acid shares that same transporter from the gut. So biotin, B5, and lipoic acid will all compete for absorption. And so I felt it was important to add lipoic acid to the mix. And then I put them on some low-dose niacin. You know, niacin is so central in the Krebs cycle. It's used in, 3 places in the Krebs cycle, and it's used in the electron transport chain for making energy. And the niacin deficiency can cause some anxiety-type behaviors, and he was exhibiting that. And giving niacin can kind of help, can be quite calming. So we put him on some niacin, and then I also added Immunothrive for his histamine intolerance. That's a supplement that I had developed for histamine sensitivities, because the herbs and Immunothrive all work synergistically together at the regulatory of the T helper cells, the T helper 1 and T helper 2 cells, because in histamine intolerance it becomes dysregulated with the T helper 2 dominance. And so these herbs work at that immature T cells to help regulate and put those back in balance, and I've found it to be quite successful in histamine intolerance. So we put them on 1 capsule daily. Now, the results were quite astounding. The mom told me that the spinning behavior completely stopped within 3 days after starting high-dose biotin, and many of his sensory issues had started improving as well. And she said within 2 weeks, he started accepting more foods into his diet of fruits and vegetables that he would never accept or touch or even try. And then we were really excited when the thyroid labs had improved and normalized for the first time in 2 years. She said that he still had some emotional breakdowns, but the difference is that now he was able to verbalize what the triggers were and able to talk about his wants and needs. And so after 2 months, the preschool teacher and occupational therapist had recommended that he enter mainstream school. And here's a list of my references. If you want to pause the the video at any time, you can take a look at the references here. Now, I would like to share a before video. So I'm going to share my desktop here with you. And the mom had sent me a video that she had taken for the behavioral therapist just a week before our appointment. And it's just a really cool, small video clip here. Hang on just a second. Okay, so here is the before video. And you can tell, here's our little boy here, spinning and spinning. Okay. So after he had been on biotin for 3 days, she retook this video. And see the little boy jumping up and down. Our little boy is this one right here, standing right next to the one jumping down. He's paying attention. He's participating like a neurotypical 6-year-old boy. And sorry for the poor quality the mom has taken this video. So he's just, the high-dose biotin completely turns this child around. Anyway, so we were really thrilled at how well this treatment worked for him. And I wanted to share all of this with all of you mainly to let you know that there is some really good biomarkers that we can get from the NutriVal, from Genova Diagnostic. And somebody that really knows how to analyze these markers can really hone in and pinpoint what is going on with these kids. Anyway, thanks for watching my video. Have a good day.